Your surgeon said surgery is the only option for your core, but let's actually talk about the science. Is it true that your linea alba can't regain tension? For years, many of us women have been told that once your linea alba is damaged, it's damaged forever, and that the only way to correct that overstretched tissue or overstretched rubber band is surgery. But current research has shifted this conversation, and today that is exactly what we are going to address.
Hey there, I'm Celia, women's health and pre- and postnatal specialist, nutrition coach, trainer, and mom of 4. I help women feel strong and confident in every season because a strong you is an enabled you. You matter and you are worth being well. Let's dive into today's topic.
Let's chat about what we often hear. It's stretched and it can't go back. The problem with this statement is the fact that some surgeons are leading women to believe that once our linea alba has been stretched from pregnancy, which is normal for all of us, it's cooked, it's done for. But the linea alba is not dead stretched tissue. It is living connective tissue. And it is structure that is largely made up of collagen. And that structure helps us transfer force across our abdominal wall. It stretches during pregnancy to make room for baby. And so often we think, oh, it's stretched, or we're told it's stretched and it can't go back. But I want you to think of your linea alba like a trampoline. A trampoline with good tension is supportive. It transfers force efficiently. It feels supportive. It handles load well. It's taut and tight when we jump on it. A trampoline with poor tension sags, feels unstable, transfers force poorly. The old thinking focused mostly entirely on just closing that gap that we have, and that linea alba stretch that was stretched and saggy, like a saggy trampoline, was stretched to stay, but that is not true. Newer research suggests the more important question should be, how can we get this tissue to generate and transfer tension again? And how can we work to rebuild that tension again? Because yes, it is possible, and no, surgery is not the only way. You can get a tight trampoline again, okay? It doesn't have to stay stretched and saggy forever. Two women can actually have the same width separation, but function very differently, all depending on the tension and their force transfer ability due to that linea alba, which is why we check the depth as well when we are checking for diastasis recti. The goal is not simply to just make the gap in between smaller, it's to also improve the function and the tension of the linea alba, because tension, not width alone, is what also helps to support our core through movement. Science continues to move away from just closing the gap at all costs through surgery alone and more towards restoring pressure management, load transfer, and connective function, because it is possible. So if your surgeon is telling you that your tissue cannot regain tension and that surgery is the only way to get your saggy trampoline, so to speak, firm, I would like you to bring up this education to him and ask him or her about this current research. Research that we have proving and rebuilding tension is absolutely possible. Now, I am not saying there's never a place for surgery, but I am saying that if you're being told surgery is your first and only option, it is not supported by science. The majority of us women need to first focus on the science-backed healing and rehab for tension rebuilding and core function again. And it is very possible for the majority of us. I want you to think of going to core healing first as your first option and your first thing to try. Just like we have those go-to appliances in our kitchen, like our dishwasher and the oven, the things that we go and we grab and we use. That should be science-backed healing first. Then we have those occasional gadgets, those ones that we grab here and there as needed, one of those gadgets that we grab now and then. That is surgery at times needed for certain scenarios, but certainly not the majority of us. I want you to first start focus on that core rehab. We will talk more on this on part 2, where we actually talk how to take action to improve that tension in our linea alba again, that tissue, to get that tight trampoline. I do want to give you the reminder that you are the best advocate for your health. Surgery is not the only way, and if your surgeon is claiming that after having this conversation and bringing this up to him or her, then I want to give you the permission to kindly and respectfully but firmly fire them, okay? You need updated research. And if you are feeling a little discouraged because you're struggling with a weak linea alba and diastasis recti, I want you to know that the majority of women at the end of pregnancy all have diastasis recti. It is normal for that tissue to expand. It has to expand. That tissue lengthens to allow expansion for your baby in the womb. And so it's perfectly normal. It's just not normal to struggle with it after baby forever. Okay? And there is so much movements, breathing patterns, breath work, and core work, etc. Different exercises we can do, tension rebuilding protocols that we can take to restore both that gap in strength in your core musculature, but also that tension in that tissue. So surgery is not your only option. Surgery should not be the first option. Again, I am not saying that there's never a place for surgery, but we are often sold surgery first. I have a respect for surgeons, and we have a wonderful place for surgeons. But if the surgeon is just telling you that is your first and only option, that is why I'm addressing this today, because women have been told that. And so I'm not saying for the individual, the specific situation or specific scenario. I am saying this for the women that have been told that surgery is their only way. That is simply not updated science and research. So if you are feeling discouraged, I want to encourage you. One, it happens to all of us in pregnancy, okay? Like I said, your abdominal and tissue and muscles had to expand for baby. But post-baby, okay, if you want that tight, taut trampoline for not only functionality, but also aesthetic concerns, it is possible. Okay, you can get a supportive, stable, and efficient force transfer again out of your Linea Alba. So surgery is not your only option. It is not the first thing that you have to go to. It's why I built my core program, and it's just not current research. So we're going to talk more on this in part 2. For now, just be reminded, you are the best advocate for your health. Make sure your surgeon is up to date on current research, and know that there is hope for you that does not require surgery first or only.
If this video was helpful, I would love it if you liked, subscribed, and turned on that notification bell. And if you want deeper support, workouts, and education, you can find everything linked in the caption below or the link to the app in my bio. Thank you for being here, and remember, you matter and you are worth being well, mind, body, and soul.